like Sarah said, I'm Holly LaFavers. I would by far not say that I don't even remember the word she used, for fetal alcohol spectrum disorder, but I will say, the past 5, 6 years, I have took a deep dive, for my son so that I could be an advocate for my son and I could learn about my son, and learn what makes him tick, for lack of better, words, and, just how I can help him to be a better and more productive member of society. So what I'm going to do first, because I know Miss Tina's on here. So Miss Tina was one of Liam's, teachers when he was 2. So if anybody else is on here who has worked with Liam in the past, if you'll just drop your name in the chat, that way, later on, I might just call on you to share some stuff about Liam, that maybe I don't know happened in the classroom, or some things that I forgot that happened in the classroom. And then the other question I'm going to ask you guys before we even get started, is if you have worked with a child that has a diagnosis of a fetal alcohol spectrum disorder, would you drop your city or county name in the chat just so we have that? It's kind of hard sometimes just to find, other people who know what we're going through, who, who have been there, done that, getting the diagnosis alone. Sorry, I'm looking at the chat real quick, and then I'm going to pass that over to Sarah for the rest of the time. And then if you've not worked with a child with fetal alcohol spectrum disorder, do you know someone who is on the fetal alcohol spectrum? And what I feel is happening from the chat is that not many people are typing any much in there because people don't know about fetal alcohol spectrum disorder. It's not something that we really talk about a whole lot. To be quite honest, it was very, very hard for me to get the diagnosis for Liam. If I had not been an advocate for him, I don't know where he would be. So I'm gonna dive in, and we're gonna do the best we can for the next hour and a half. And I'm gonna do the best I can to keep your all's attention and to make sure that I'm putting all this to where it's stuff that you all can use, where it hits home for you all can understand why this is important for you all, how this affected him, how this affected the other children in his classroom, how this affected some of his teachers, as he's gone through, well, he's in 3rd grade now. But as he went through early care and education before we actually got the diagnosis. Now let's see. Okay, yeah, it did move. Okay, so here are your learning objectives. Those were the same learning objectives that were in, the description that Sarah sent out. So they're just on there, so we have them there and everybody can see. If you're in the wrong training, I'm sorry. I'll try to keep you entertained. Okay, these are just some true false for you all to think of right now in your head. You don't have to put anything down on paper, but just true false. Fetal alcohol spectrum disorder, which is what FASD it stands for, is not as common as autism spectrum disorder. Fetal alcohol spectrum disorder is something that will resolve as a child becomes older. You think fetal alcohol syndrome can cause learning difficulties, behavior problems, and medical problems? Or do you think it's just those behavior problems? And fetal alcohol is the only birth defect that is 100% preventable. So just think through those 4 things as we're going through here. I think I answer most of them to start off. So really and truly, my plan for tonight is to share with you all Liam's story. This is him, and he's just cute as could be. This is little Liam. Liam came to me, and he was 4 months old to the day. His biological mother had actually just gone back to jail. She had been at a halfway house, and she had been nursing Liam. And so when he came to me, he was going through active withdrawals because he had had some of the Suboxone in his system where she was on the Suboxone while at the halfway house. When he came to me, his ear infections were so bad that you could smell them. You could almost smell them across the room. Oh, my phone's ringing. I don't know why. So one of the things about Liam is that he never slept. Did not matter if it was the middle of the night, did not matter if it was the middle of the day and he was taking a nap. Liam never slept, no more than 15 minutes. That was just one of those Couldn't figure it out. We don't know why. Why does Liam not sleep? He actually had his first set of tubes put in November of 2017. So he was only like 6 months old. At that time, he also had to have his tongue and upper lip clipped also, because those were just some minor birth issues that we were able to see at the time. In 2018, we actually had an upper GI done because Liam's still not sleeping. So he's a year plus old. To be honest, and you all can be honest, I've worked in childcare, so I know he was that kid at nap time that you're like, I'm going on my break, because you don't want to have to deal with him at nap time. He's not going to lay down. He will not lay down for you. He's not going to lay down. He's not going to sleep. So in 2018, we had an upper GI done. What we found was that the lower sphincter of Liam's stomach did not open, but to drain his stomach properly. So things didn't go through. But the top sphincter of Liam's stomach did not close. So here, everything that poor baby ate sat in his stomach, and it didn't digest properly. It was coming back up. Hence, all of the ear infections. His reflux was so bad that it had caused all those ear infections. And I know Miss Tina, God love you, Miss Tina. Miss Tina would have to, for 2.5 years of Liam's life, we actually had to give him medication to force his stomach to empty when he ate. So like 30 minutes before he ate, and he had to time it, 30 minutes before he ate, you would give Liam medication, and that way his stomach would empty as the food went down. And, we thought things were getting better. And then we realized that he also had a cow's milk protein and soy allergy. So here we go again. Oh my God, here comes this kid. Can we just put him in a bubble? And I'll be honest, there were times I thought, I'm not going to be able to get through all this. So in December of 2018, Liam started limping one week. On a Monday was the first day I noticed that he was limping. Didn't think a thing about it. The next day he was limping again. I took him to the doctor. They told me nothing was wrong. Wednesday, same thing. Thursday, same thing. Friday, I took him back to the doctor. They told me nothing was wrong. Sunday, took him back to the doctor. They told me nothing was wrong. Monday morning, Liam woke up and couldn't bear weight in his leg. Wouldn't bear weight in either one of his legs. So we went to the emergency room real quick to find out what was wrong. And he had a septic ankle. So he had a virus that had settled in his body. And you've probably heard of this happening with other children. Viruses can settle in your major joints. So it's shoulders, their hips, their knee, their ankle. 1, 2, 3, 4. I'm missing a joint. I don't remember what the other joint is. And that's very common. That's very, very common for this to happen. I share with you all about the septic ankle because that shows you his pain tolerance. His pain tolerance is not even 2 years old yet, that it got that far and it got that bad before I, as his mother, really could do anything about it, or before the doctors even realized it. So then in the spring of 2019, I got a phone call from Miss Tina and here's exactly what you said to me, Miss Tina, because I'll never forget it. Holly, Liam just had a seizure. We were reading a book and he stared off into space and I couldn't get him to come back. I knew what I was looking for, so I immediately started counting. Okay, that's how important you guys are to families too. I want you all to know that. If it had not been for Miss Tina, Liam's seizures may not have ever been caught, because I don't know that I would have ever caught those seizures. So the only 2 seizures Liam had, he had on Miss Tina while he was at daycare, before we finally were able to be put on medication. In December of 2019, he finally became a LaFavers after 2.5 years of being in my care. In February of 2020, right before the world came to an end. So Liam's not even 3 years old yet. And I'm reaching out to developmental pediatricians because we got to do something. Something's going on with this kid. He is wild. So at 2.5 years old was the first time that Liam was given medication to calm down. And I hate to say it that way. But he was bouncing off the walls. He had been in Head Start and public preschool, and God love him. My kid was the one, and again, I can say this to you all because I've been in your all shoes. My kid was the one that you're like, I hope he's not here today. Maybe he's sick. Or on those days that he's sick, you're like, whoa, thank God it was really quiet in here today. I've been there. I know. I get it. but all of a sudden it was my kid. It was my kid that this was happening to. So when the doctor gave him that medication, he said to me, when you are ready, you can start him on this. I didn't, because as a mom, nobody wants their child to be on these medications, and especially not even being 3 years old, putting him on this medication that basically was going to sedate him. It was going to drop his blood pressure to calm him down some. And we went to our pediatrician one afternoon, and Liam was having a good old-fashioned fit. And she looked at me and she said, "Why do you make him feel this way?" And I thought, I don't make him feel this way. I'm not doing this. And she said, if that doctor has given you medicine to help him and has given you medication to help him not feel this way, why are you not giving it to him? And it's like the light bulb went on. You're right. I am doing this to him because there is something out there for him that's going to help him. At that point in time, Liam had just had the diagnosis of ADHD and neonatal abstinence syndrome. He was born addicted to drugs. In June of 2021, he was finally referred to a sleep specialist. Come to find out, we were having seizures because we were not sleeping. We were not sleeping because Liam's brain never stops. Liam's brain never stops due to the brain damage that was caused from the alcohol that his birth mother consumed prenatally. So what Liam was diagnosed with is something called periodic limb disorder movement. He actually, for a long time, I thought he was having seizures in his sleep because that's what it looks like. His whole body just moves and moves and moves. Once we got that diagnosis, we had the world by the hand, so I thought. But it wasn't until February of 2022, oops, I did not mean to do that. February of 2022, after I had been home with him for 2 years, we had not been at school, his behaviors just kept escalating. He was the kid that would just stick his arm out and clothesline another kid just because he thought it was fun. He was the kid that would just walk over across the room and just knock the crap out of another child just because he thought it was fun, and he would laugh about it. I, as an early interventionist, I knew something wasn't right. And I needed more help. So I reached out to my friends at what used to be Wisecoff, and got Liam in to see a fetal alcohol specialist in Louisville. That is when Liam was diagnosed with fetal alcohol spectrum disorder. He was diagnosed as being on the fetal alcohol spectrum. Let me say it that way. Here's why that changed our life. That changed our life because that was when I realized that I was the one that was going to have to change because he couldn't. These were things that were totally out of his control. This is something that his birth mother did to him, and it's not his fault. I had to adjust my expectations, and I want you all to hear the word adjust my expectations. I didn't change my expectations, and I did not lower my expectations of him. I had to adjust my expectations because he's going to do it. He's just going to do it at his own pace, on his own terms. I learned that when I say his name or when I'm asking him to do things, he's not ignoring me. He's processing. Liam has a 3-second processing delay. So if you say his name or you say pick this up or anything that you're saying to Liam, at a minimum, at a minimum, it's a 3-second processing delay. So let's say you tell Liam to go over and pick something up out of the floor. It might be a minute before he actually walks over and does it. He is not defying you. He's not ignoring you. It takes that long for his little brain to process what's going on. I learned that I had to adapt his environment, and I learned that I had to know his triggers so that he could stay regulated. This is not enabling him. I'm not enabling him, and I'm not letting him know that these behaviors are okay. These is something out of his control, and so it's my job as his mother to know these triggers, to share these triggers with other people so that he can function to the best of his ability. And most importantly, I learned that I have to keep myself regulated because we all work with kids. And if you have your own children, you know how easy it is to get so mad when they're not doing something you want them to do, or when you've said something 20 times and they're still not listening to what you say. I have to keep myself regulated, and he is listening, giving time. So I have to slow myself down. I had to slow my life down, which if you knew me before Liam, slow was not a word. So why is fetal alcohol now? Oh, I'm sorry. Terms that you all already know that we are not going to be talking about tonight. The neonatal abstinence syndrome. That is those babies who are born addicted to drugs, what we all refer to as drug babies. And I'm sure if you've had a foster child, they've been referred to, oh, they were a drug baby. Their mom was on drugs. Most babies that are, who we consider to be drug babies or NAS babies, they are detoxing from opioids that their mother used prenatally. And so opioids, for those of you who are like me and know nothing about medication and drugs, those are your things like oxycodone, hydrocodone, fentanyl, morphine, codeine, heroin, and any of those painkillers and those types of things. So those are the things that those babies are detoxing from. And then, of course, autism spectrum disorder, ASD. When I refer to Liam's diagnosis, the FASD, a lot of times people go, oh, he has autism. No, that's not what I'm saying to you. Liam does not have autism, although sometimes I think he does. Liam does not have autism. That's not what we're talking about. We're talking about fetal alcohol spectrum disorder, not autism spectrum disorder. So I'm sure at some point in time you have heard of fetal alcohol syndrome. And what you're hearing and seeing with a child with fetal alcohol syndrome is a child who has the facial deformities to go along with some of the learning and behavior disabilities that you would expect from a child born with fetal alcohol. So fetal alcohol disorders became a spectrum because, just like autism spectrum disorder, the intensity and the symptoms can range from mild to severe from child to child. It's a spectrum. We don't know the support levels that they need. Not all of them need the same support levels. Some of them need minor amount of support. Some children are going to need majors. Their individual experiences are all going to be different. I have several friends who have fostered and adopted. Their children also have the fetal alcohol spectrum disorder diagnosis. But our children aren't the same. Our children aren't the same by far. And it also broadens the definition. So it just makes it like when they pulled Asperger's in underneath the autism umbrella. So just by having it as a spectrum, we have the umbrella of fetal alcohol spectrum disorders. And then the functional impact that it has on these kids. Again, it's not going to affect any two children the same. So that is why it is now a spectrum disorder. Or if you weren't sure why anything was labeled a spectrum disorder, that's why things are on a spectrum. My understanding is sooner rather than later, they believe that the neonatal abstinence will also become a spectrum disorder because there are such a broad range of things that happen with the children. So what exactly is fetal alcohol spectrum disorder? It is a set of physical, behavioral, and cognitive disorders seen in individuals exposed to alcohol prenatally. It is a lifetime disability. It is a brain injury. A very dear friend of mine is a pediatric neurologist at UK, and she and I were having a conversation about something one day, and she said, Holly, people just don't understand alcohol is poison to newborn or to infants, to babies when they're in the womb. Please know, I am not anti-alcohol. I'm not anti-alcohol whatsoever. I am anti-alcohol for a woman who's pregnant. And that's my soapbox. But please, as we continue to go through this, please know, I am not anti-alcohol. I do not want to throw blame on anyone. If you were a mother and you didn't know that you were pregnant until you were 4 months pregnant and you drank those first 4 months, you didn't know. You did not know. And there are a lot of people that did not, a lot of people who don't know. So that's not your fault. So just please know that I'm not throwing blame on anyone. I'm just sharing some facts and again, our story with everyone. Again, there that it's a spectrum because of all the characteristics and how they can be different. So when you look at fetal alcohol spectrum disorders, at the top, it's the fetal alcohol syndrome, which we all see, which that's the one we've all talked about and heard of. It is what you would refer to as the worst. It is the facial features. It is the mental retardation. It is, all the other handicaps that can go along with their little bodies. And then they go down and they change. I will say that my Liam is on the neurodevelopmental disorders prenatal alcohol exposure. I refer to him as being neurospicy. He is neurospicy. That's if you saw him out somewhere, you would honestly think, oh, bless him, he has autism just because those little neurons, he's just spicy. There's no other word to explain my Liam except for he's spicy. He's got a spicy little attitude. He's got just spicy. We'll stop with that there. So what are the medical conditions that are diagnosed? These are the things that you see or the things that can be tested in these children. So it is the facial dysmorphology, the small eyes, the smooth groove between their nose and upper lip, the thin upper lip. They refer to them as railroad track ears. I still have not figured out what that is, even though the doctors have tried to explain it to me several times. And then that really flat nasal passage. I will tell you all, and then you all saw pictures of Liam. When I took Liam for the evaluation, they told me that they showed me every single one of these in him. I would have never seen these because I saw Liam as being Liam. I was his mother. And I had seen him for such a long time, but when the doctor pointed them out to me, I was like, oh yeah, you're right. It is there. It is there. Growth deficiencies. Most children who are on the spectrum are either small prenatally or they're small postnatally. Like below the 10th percentile is what you're going to see. The central nervous system damages, well, again, what I call my neurospiciness, seizures, the reduced white matter in their brain, and the absence of the corpus callosum. I can never say that correctly. And then the neurobehavioral and cognitive impairments, lower IQs, learning disabilities. I was just talking to Sarah. We are actually going this week or next week to be tested for dyslexia. So add everything else onto my poor little guy. Now we're going to be tested for dyslexia to see if that's something else we're going to fall on there. Poor executive functioning planning. So if you don't know what executive functioning is, it's your planning and judgment. It's knowing something and how to do it and then being able to carry out that task. And then of course, language delays. We all see those. And the big thing I should have known because early intervention is my background. I should have known. And again, as a mom, I think sometimes you just forget things. But those structural defects. So you look at the heart defects of children with fetal alcohol spectrum disorder. A lot of them have kidney malformations, auditory and visual processing, and then the skeletal anomalies. My little Liam's fingers are so small. I was going to get you all a picture of his fingers and I couldn't do it, but the palms of his hands seem to be growing, but his fingers aren't growing at all. So it's making his fine motor skills be even more difficult than what they were to start out with. So just for fun, this is a list of medical diagnoses that Liam has on his my chart right now as we speak. The attention deficit, executive functioning disorder, developmental coordination disorder, seizures, periodic limb movement. I mean, you name it, it's on there. These were the ones that I found within the last 2 to 3 visits. What you all are going to learn as we keep talking though, is every single one of these diagnoses is a symptom of fetal alcohol spectrum disorder. So there were times that I felt like I was doctor shopping, but I wasn't doctor shopping as much as I was finding a doctor who understood and was going to listen to me and where I was. And to this day, if we go to a doctor and the doctor I say, oh, he's on the fetal alcohol spectrum. And they say, oh, just put on there that he has fetal alcohol syndrome. I'll say, no, sir. Nope, that's not where we are. That's not who we are. We are on the fetal alcohol spectrum. The medical profession still doesn't know much about fetal alcohol. So parenting a child with additional needs is like playing a sport where no one knows the rules. The goalposts are always changing, and there are more referees than there are players. So think about that. And then just for point of reference, this is a list of our referees. This is a list of the doctors or therapists. This is just the list of medical doctors that Liam has. This does not include any of his educational supports that he has. And I may be that mom that's over the top, but I'm doing what I can to make sure he gets what he needs. And so when an FASD parent hears, we don't see that behavior here, trying to summon all their self-regulation skills to learn not to lose it. Again, you have to have a doctor who listens. You have to have a doctor who's knowledgeable, because they have to listen to what the parent is saying, believe what the parent is saying, and use all of it, not just what they're seeing in that moment, in order to diagnose these children correctly. So unfortunately, 1 in 20 school-age children in the United States may have fetal alcohol spectrum disorder. We are expecting to see those levels rise significantly coming out of COVID. We are expecting to see those climb drastically. There are 428 possible, I cannot say this word, comorbid conditions that go along with fetal alcohol syndrome. So what that means that there are 2 or more distinct medical conditions that exist together. So 428 things that 428 diagnoses that a child on the spectrum could have. And 90% of people with fetal alcohol diagnosis also have mental health challenges. It's huge, huge mental health issue. I'm going to be open and share as much as I can about Liam. Liam is already on a medication for bipolar. We refer to it as a mood stabilizer at this point. However, he has already, at 6 years old, he had to be hospitalized at Our Lady of Peace in Louisville to get his medications regulated, because it wasn't safe for him or for him to be at home. And if you can imagine how hard that is as a mom to leave your child at that hospital, I've realized after I did that I could probably do anything that I wanted to. Oh, here it is. Fetal alcohol spectrum disorder is more prevalent than autism, Down syndrome, CP, cystic fibrosis, spina bifida, and SIDS combined. So not just more than autism or more than Down syndrome, it's more than all of these combined. Okay, so why are we talking about it? Why am I here? Why am I sharing this? Let's start the conversation. I'll tell you all why I'm talking about this, because for the longest time, my child was labeled as the bad kid. Again, I will tell you all, I've been in your shoes. I know what it's like. And so I'm not judging anyone. And I know it. I know my child. There was a situation at one point where I had to call because the classroom was never in ratio that he was in. And when I called over the director's head to say something, the gentleman I talked to, I said, look, I'm being honest with you about something. I'm not worried about my kid getting hurt. I'm worried about my kid hurting someone else, and then you all getting mad at me. That's where we were. So as I've looked more into fetal alcohol, and I've talked to some high school students, I've talked to some high school teachers and middle school and those types of things. As you all know, drinking alcohol has become a social norm. When I was younger, our county was dry. I grew up in Somerset. It was dry. You couldn't get alcohol there. You had to drive to Lexington or Richmond or Knoxville, I think, maybe Bowling Green, but you could not get alcohol. Today in Kentucky, only 10 or 11 counties are completely dry. So it's just easier to get a hold of. But we have also moved from we focus on drug prevention. We focus on those big things like the fentanyl that's coming in. We focus on cocaine. When we talk about prevention, when I was at the Department for Public Health, we are lumping alcohol into that. We are lumping alcohol in as a drug when we start talking about things, but unfortunately, most people don't hear that and don't see that. It was in 1970, though, that the laws came out that the warning labels had to be on alcoholic beverages for pregnant individuals. When you go to a bar, for anyone who's ever been to a bar, there's going to be a sign up there that says you cannot, you shouldn't drink if you're pregnant. We know drinking alcohol is going to cause problems with that baby. So why is it legal to serve someone who is pregnant alcohol while they're pregnant? You tell me. So what do we need to do too? It's just like I talked earlier, we've got to remove the social stigma. The social stigma has to go. There are all kinds of TV shows nowadays where I didn't know I was pregnant and all of a sudden I gave birth. I believe people it happens. I've never been pregnant, so I don't know what it feels like, but I believe that it happens, I guess. So what if you didn't know? What if you didn't know? If you did not know that you were pregnant and you consumed alcohol, you didn't mean to do this. I also want you all to think, and this is a conversation that Sarah and I were having with some of the representatives before that we've all had, is if you really think about it, and we always talk about, the drug babies, but what do you think these moms are drinking while they're using the drugs? Because I'm going to bet it's probably not water or milk or something that's good for them. I'm just betting. I'm not saying that I know that as a matter of fact, but I am going to say that. Here's why we're talking about it, because fetal alcohol spectrum disorder is 100% preventable. It is the only birth defect that is 100% preventable. So why aren't we preventing it? Why aren't we doing anything to prevent it? Why aren't we talking about it? So 1 in 7 pregnant adults in the USA have consumed alcohol in the past 30 days. And that's from fetal alcohol, the FASD Unite. So when I was in college, my background is early intervention, but when I was in college and you hear people talk about this, I'm like, there's no way people drink when they're pregnant. Why would somebody do that? Well, one, they may not know that they're pregnant, and two, it could be an illness. They could have a problem with alcohol and not be able to step away from it. Oh, how common is pregnancy or alcohol use in the United States? 1 in 7 pregnant women report currently drinking alcohol. About 1 in 20 have reported binge drinking. And it's highest among the women who are in their first trimester of pregnancy. But when we think about that, what happens during that first trimester of pregnancy? Your embryo becomes a fetus. At week 5, there's a heartbeat, and your neural tubes are developing that eventually become the brain and the spinal cord. Week 6, their arms and their legs developed. Week 8, it's your fingers and toes, your face, your ears. So the drinking happens the majority of the time during the beginning of pregnancy. These are all the things that it's going to affect. So here's in Kentucky. In 2019, I think the data slowed down. And Sarah, I've been away from the state for a while, but so this has not been updated. But I think, is data getting caught up, Sarah, from COVID, or is it still lagging behind? Do you know?
Some of it is. It depends on what data you're looking for specifically.
Yeah, and this is probably one, unfortunately, that's not important. So almost half of the women in Kentucky who have recently had a live birth, who in 2019 had recently had a live birth, said that they consumed alcohol within the first 3 months prior to being pregnant. So they might have been pregnant when they were consuming alcohol and they didn't know it. Knowing where I've been and where my sister has also adopted a child who has fetal alcohol, we actually had a friend who called us to let us know that she was pregnant and let us know that she figured out she was pregnant because she was at the bar drinking and she started throwing up. Well, okay. So how pregnant was she? How long has she been pregnant? And what was growing and what did it affect of her child while she was? And yet, just to clarify, she and her husband were trying. So we'll stop there. Okay, so what are some struggles that you see for these kiddos? You're going to see behavioral and emotional regulation. Difficulty with impulse control. They cannot follow rules. They either can't follow the rules or they hyper focus on the rules, one or the other. And they engage in risky behaviors. The average age for an individual with fetal alcohol spectrum disorder to actually live is like 28 years old, because of these risky behaviors that they engage in. It's because they don't understand consequences, period. And I'll talk about that in a little while more, but don't understand consequences at all. Emotional regulation. They are so frustrated. They get frustrated so easy, and their frustration levels are so high. Very irritable, and they have a hard time calming down. A very hard time calming down. I know the threshold that Liam can get to where we're done. We're done, and I'm going to have to give him emergency meds, and we're going to have to walk away because he's not able to pull himself down once he gets to that spot. And it could be something as simple as washing his hair that throws him overboard. You just don't know that day. Social challenges. They have difficulty understanding social cues, building friendships, and complying with social norms. One Sunday, we went to church and Liam had his polo shirt on backwards. Huge meltdown because I asked him to change it. He's 8 years old. He should have known that shirt was, on backwards. But he doesn't care. It's just that he doesn't care. It's a social norm that he just really does not care about at all. And they internalize a lot of behaviors. So you're going to see a whole lot of poor self-image, negative talk about themselves, and then a whole lot of anxiety. I did not realize that Liam had anxiety. He used to flap, and then at one time he was pinching. It was like he was grabbing words out of the sky, and then he would walk on his tiptoes often. But come to find out, those were all anxiety and ways that his body was handling the anxiety that he was feeling on the inside. Poor memory is a huge thing that you're going to see with these babies or children, people, individuals. Fetal alcohol spectrum disorder is sometimes called Swiss cheese brain, and it's because there's holes. There's holes in the brain where things just aren't connecting. What stinks about fetal alcohol spectrum disorder is from day to day, you don't know where that hole is going to be. So one day, Liam might be able to put his clothes on all by himself. It's not a problem. He might be able to read this huge book to me, or he might be able to tell me all his multiplication facts. And we might be able to do this for a year. And then all of a sudden, one day, they're not there. Because that is the day, for some reason, his brain is not making that connection. Sometimes it can last for extended amounts of time. Sometimes it just lasts for like a day or two. It doesn't just affect their little brains. It affects other things. Like there was one that it went on for 48 hours where Liam basically forgot how to swallow. Now you'll come on. How do you forget to swallow? But that's because of his Swiss cheese brain. And that was the hole that was there that day. So all of a sudden he was just choking. Every time that poor little guy went to swallow something, he was choking and making himself throw up and choking. I thought, oh my gosh, we're going to have to go back for another swallow study. Here we go again. And 48 hours later, boom, it was over and we moved on. And we currently, knock on wood, we're not having that problem. But that is just one of those things that I'm prepared for. So lower IQs and with specific learning disabilities, And particularly with math, I will tell you, my Liam is a genius in math if you let him do it mentally. His mental math is amazing. He can look at something and be like, oh, that's 8 and 8 and that's 64. He doesn't even like have to count them when he's looking at them. His struggle is reading. And I'm not sure that's one of the reasons we're going for the other testing to see if maybe we have something else going on there too. And then the executive functioning skills. So challenges with planning and organizing things, challenges with understanding consequences, challenges with time management. Those are just all of those day-to-day things that most people can do. And then, oh, I didn't switch the slide. I'm sorry. It's in front of me. I don't know why. So then the physical problems, low body weight, poor coordination, heart problems, shorter than average stature, vision, hearing, microcephaly, those tiny, tiny heads, the sleeping and sucking problems. And then the problems with daily living, and these are long-term daily living things, independent living. I don't know that I'll ever be able to trust my child to cook something for himself on the stove. He'll be 9 years old in April, and we still to this day are working on being able to pour into a cup from, like, if he wants orange juice, to go get it himself. Because like I told you all, he has that 3-second processing delay. When that 3 seconds, it's overflowing and going everywhere. Because his brain or his body may say, oh, I need to do this, but it takes a little bit longer for it to kick in. And that can cause a big, huge mess. Typically with my Liam, I can also say, or if he says, I'm going to go ahead and use this. He says, I want to have a carnival. I'm going to have a carnival. I can say, okay, Liam, tomorrow we'll have a carnival. That's fine. He's going to forget about it. He's going to completely forget about it because we live in the here and now. We live in the here and now with everything that we do. There's no planning for anything. There's no remembering anything. We are in the here and now all the time. So, as a fetal alcohol spectrum disorder mom, I will tell you that I used every strategy that I have ever learned, every strategy that I was ever taught, every strategy that I helped other families with. They don't typically work with these children. So sticker charts, if I had one more person say, oh, try a sticker chart for him. Sticker charts don't freaking work with these children. They work with some children, but sticker charts don't work. What we did learn after playing around with things is Liam needs immediate gratification. So we give him quarters, or at school, they've given him plastic tokens that he thinks he's going to exchange for money later on. But that's immediate gratification to him because that's something he has in his hand. It's tangible, it's something he can put in his pocket, and it's something that he can collect and hold on to. So that's just one of the things that we learned with him. So there are many parents, after I worked in First Steps for 10 years, that I want to go back and apologize to. I've thought sometimes about getting on Facebook and just writing a full apology to some of these parents saying, I'm so sorry that I told you to do this and I kept telling you to do this and it never worked, because now I get it. Now I'm a mom and I get it. Sometimes these things just don't work, that we try our best to incorporate. So how is fetal alcohol spectrum disorder diagnosed? You don't have to confirm that use of alcohol in utero, although the doctors really like to see it. Then, of course, the testing for the central nervous system problems, the lower than average height, weight, or both, and the abnormal facial features. This is hard to see, and I know it's hard to see, and especially if you all are on something small. But I'm also going to give this to you all at the end of the present, when we get done here. So what you'll see on that gray line are, okay, so the yellow line are the symptoms that you can have, that children or people have with mental health problems. So it's the impulsivities, the easily distracted, those types of things. And then across the top, you have the fetal alcohol spectrum disorder. ADD, ADHD, your sensory, your autism. But what this chart does is it shows you how fetal alcohol spectrum disorder overlaps with other things. You'll see how everything that is with fetal alcohol can overlap with other things so much, and that's why it's sometimes very, very, very difficult to get the diagnosis or to understand what's going on. Oh, come on, work. Okay. So with fetal alcohol spectrum disorder, the difference in what they know and what they can actually do is the disability. My Liam had first steps from the time he was 18 months until right at 3 when COVID had kicked in and all that happened. I am a certified developmental interventionist, but I had one working with him, and he was also getting speech therapy and occupational therapy with first steps. He's now. I was also taking him to private therapy, so he was getting physical therapy, OT, speech, and eating and feeding at Cardinal Hill, which is now Easter Seals. So when my child went to kindergarten, he was labeled the ideal student. I was told that he knows all the answers. He can answer all the questions. That's great that he can give you the answer. The problem is that his executive functioning is poor and he can't act them out. He can't carry on with them. He can't carry through with them. And so that's why the executive functioning piece is really hard. And I'm getting ready to show you all a slide, and I so wish that I could see some of your all's faces, but we're going to talk about how big executive functioning is. So who all saw this in the national news? That was my Liam. It was my, I'm seeing some faces. I wish I could see everybody's faces. Hold on 1 second. Yes.
Just letting you know.
Okay. Thanks, Dennis. Thank you. Be safe. Sorry, it was one of my coworkers leaving. Yeah, so this was my Liam. My Liam wanted to have a carnival. My Liam ordered $4,200 worth of dum-dums that were delivered to my front door. He knew not to do it, you all. He knew not to do it. I wish I could like take a screenshot of some of your all's faces right now. He knew not to do it. But in the moment, he couldn't stop himself. He truly could not stop himself. So I'm telling you all this, and one, just to give you all a little laugh too. But yeah, it was, we actually went international. Never would have thought. We went international. I had someone from Australia and somewhere else calling me, wanting me to sell them my story or wanting me to sign my story over to them. I was like, sign what? My kid ordered a bunch of dum-dums. I mean, I don't understand. Yeah. So that's how many people saw it in the post and all that fun stuff. And here's all the news channels. Okay. So why is this a big deal? Why do we talk about it? Why am I talking about this with you all? I'm talking about this for a couple of reasons. One, I got blasted for not disciplining my child over this. I mean, I was blasted on social media. Liam didn't understand what he was doing. He had no clue what he was doing. His punishment was that he was not allowed to open them because his punishment has to be in the here and now, just like his mind is constantly in the here and now. So he wasn't allowed to open them. He wasn't allowed to touch them. That was his punishment. But I'll also say that to then give you all the reason why. When Liam would say, oh, I want to have a carnival, it's a big deal when Liam could take my phone and window shop on Amazon or wherever he was and put the things into the cart that he needs for that specific task. That's an executive functioning skill that we were working on. It's planning something, knowing what he wants to do and planning it and moving forward. And so one, that's why he had my phone. But two, yes, it can be this big. It can be small things like jumping in the swimming pool. I've watched him several times. You can see his little body. I'm like, don't do it. Don't do it. And he doesn't want to do it, but his body just goes and there's no stopping it. I kind of relate it from time to time to if you've ever seen Balin off of that has the Tourette's, that has her own TV show now. And sometimes her parents are out in public with her and she screams some vulgarity and they're like, oh God, well, I kind of understand where they're coming from. And I feel for them because I don't know what's going to happen. I don't know if we go into a store, Liam's going to see some glass figure and just knock it over. He knows not to do it. He knows not to do it. And immediately after it happens, he's going to become upset and he's going to be sad and he's going to know that what he did was wrong. But in the moment, he couldn't stop himself. So when you have those children in your classroom, who are the ones that are constantly hitting, who are the ones that are constantly throwing, who are the ones that are just constantly doing something, let's take a step back and think, why are they doing this? Okay, can they stop themselves? Can they truly stop themselves from doing this? We don't know. And I know it's frustrating. Believe me, I know it's frustrating. But now as a mom and all of the research and all of this that I've done, it's truly something that they can't control. So here's the good side of the story. We got to go for a visit to Spangler. They called us to help us get rid of all the suckers, and they're just wonderful. I'm just showing these with you all for the fun of it. But there's Liam pulling suckers off the line. Those may be the Easter suckers that are out right now. I don't remember. He was eating circus peanuts off the lawn. And then they just rolled out the red carpet. Just FYI, they're phenomenal people. Phenomenal people. All right, so what are you guys going to see in the classroom? What are you going to see in your classroom as early childhood that could send up a red flag for you to go, oh, maybe there's more to this? You're going to see those learning and memory problems. Those kids that can never remember your name. Hey, teacher. And they've been in your classroom for how long now? Or you know what? They finally remembered your name, but for some reason this week you're hey teacher all over again. Or they can't remember their friends' names. We still have that trouble at our house quite often. Remembering our friends' names, remembering where things go. So it's time to clean up. It's time to clean up. And they're walking around the room carrying a bin. And you say, come on, you know where that goes. Do they? Do they need just a little help to be pointed in the right direction? It's not that they're trying to be hard to get along with. It's not that they're just being this, I don't even know the word I'm looking for. Maybe they don't know. But those are the things those are just some of the things that you all are going to see in the classroom that would be things that are learning and memory problems. Hey, Miss Tina, was there anything learning and memory that you remember about Liam from when you had him in class?
Feel free to unmute yourself.
Oh, yeah. That was so long ago.
It was a long time ago, wasn't it?
It was a long time ago. But I do remember the seizure, and I do remember how he didn't sleep and how we had constantly had stuff to do with him because he did not sleep and he didn't want to be still. We had to do stuff that moved around, and he was always ready to, he was always going, go, 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 go.
Constant.
All the time. But he was the sweetest baby.
Yep. Oh, he still is. He still is. We refer to him now as the hug machine. Our problem that we're having right now is that he wants to hug random strangers in Walmart. I'm like, you can't do that. So that's where we are right now. Another thing about the learning and memory that goes along with the executive functioning is maybe you can say, okay, so here's what we're going to do. We're going to put the puzzle in the box, and then we're going to take the box and go put it on the shelf. Then you're going to go sit down in your seat. That's 3-step direction. I mean, that's 3 directions. That's not hard. Not hard at all. That's pretty easy for early childhood class, well, for most kids. Liam can repeat those to you. He can look you straight in the face and say, I'm going to put the puzzle in the box. I'm going to take the box and put it on the shelf, and then I'm going to go sit down. Okay, Liam, thanks. Take care of that and do that for me. Liam might start taking the puzzle apart, and if you're not there helping him and giving him those prompts and those cues to help him continue doing what he's supposed to do, the next thing you know, he's going to be out on the playground while the rest of the room is sitting in circle time. He cannot follow through with those tasks. He can tell you all day long. He can tell the other kids what they're supposed to do, but for some reason, his brain cannot follow through with those tasks. Switching attention between tasks. So that's that transition. And I know you're always hearing about transition. There was one day in one of Liam's, and it was not Miss Tina's room, but there was one day in one of Liam's childcare facilities that when he came in, they told him he could play. And within a minute, they were like, no, everybody sit down because we're going to color. And then as soon as he sat down and got the crayons out, then they said, put all the crayons up. It's time to eat breakfast. Wow. So I had dropped him off. That's one transition. He had gone to play. That's 2. Crayons, 3. Breakfast, 4. That's 4 transitions in a short period of time. Guess what my kid did? Had a total meltdown and had to be removed from the room. So again, we talk about those transitions. You talk about them all the time. But how do they really affect kids? And if you see a child that's truly struggling with transitions all the time, maybe there's something neurospicy going on in there that needs to be mentioned to their parents so that they can get the help that they need. Controlling emotions and impulsivity. I'm just going to tell you all saw the dum-dum things. I don't have to tell you any more about his impulsivity. It is there and it is hard. Here's what you're going to see in the early childhood classroom though. Those kids that run away. Those kids that just dart out the door. Or those kids that are constantly bouncing. Like Miss Tina said, he was always on the move, constantly bouncing from one toy to the next, one area to the next, never cleaning up, just going on and on and on. That's what you're going to see with these kids that have a hard time with their impulsivity. They see something, they're doing something, but they see something else and they think the grass is greener on the other side, and they're going to take off and go directly to that without even thinking about what they were doing before. Communicating and developing social skills. Oh yeah, that's just another. Liam has a whole lot of trouble gathering his thoughts for a conversation. So what you're going to see with these kids is, now I'm trying to think of the example that I had for you all. The children who maybe are in preschool and they should know that is a dog, that is a cup, that is a whatever. But one of the things in communication with these children is everything is still very generalized. And that's because they can't pull that name. They can't pull that from there. Another thing you're going to see is if you don't understand what they're trying to say to you, the frustration that they get. And I've noticed with my Liam, he'll tell me that he told me stuff, and I'm like, no, you didn't. So I think he processes it in his brain. It never comes out his mouth, but he thinks it does. And that's just something I'm going to have to deal with later on. But those are the things you're going to see with these guys. Not experiencing depression and anxiety. I will just tell you all, it crushes my soul that my kid cries all the time. He knows he's not like other kids. He knows he's not like other kids. He knows he can't do the things that other kids do. And it's just something that's very, very hard for him. Performing daily life skills. To this day, and I told you all that Liam does have a little deformity with his hands. He still eats with his fingers. He cannot eat with a fork. So I have to be very careful about when we go places to eat, if we go out, what he eats, and those types of things. He still needs constant assistance in bathing. These are just not tasks that he can do. He tries, but for some reason, his brain does not make that connection. And to be quite honest, as his mother, I'm more focused on school and social skills. I can help with these things at home behind the scenes. Maybe if I focused on these a little bit more, we might be there. But the minding and personal safety. So in one of the books that I'm going to share with you all here in a few minutes, um, there's a story that it talks in there about personal safety. And it talks about a little girl who was out riding sleds with her dad in the snow. She saw the truck coming from down the road. She still took off going down the hill. She knew the truck was coming. She could not make the connection that as that truck's coming down the road and she's coming down the hill, they might connect. Her brain didn't allow her to make that connection. So that's really something you're going to see with these children when it comes to safety concerns. And then, of course, that just delay in their processing. So if Liam touches something and it takes 3 seconds for it to process for him, his hand will be scalded before he's able to go, oh, wow, that hurt. And that may be actually even what you hear from him is, oh, ow, that hurt. We hyper focus on anything to do with numbers at our house. So counting and money is not an issue for us. Telling time is not an issue for us. Those are things that come very, very easy for Liam. Easy enough. So what are some things that you can do in your classroom to support children with fetal alcohol spectrum disorder? Using those visual aids. Have those routines that are always predictable. I got so lucky last year in his classroom. It was before, we weren't allowed to have phone numbers and all that with the teachers. The teachers would actually call me, the lead teacher, if she was going to be in that day, so I could prep him that his schedule was going to be a little bit different. Something that easy. Hey, buddy, Miss Williams isn't going to be in today. You're going to have a substitute. He knew if he remembered by the time he got into the classroom, but just having that predictability so that they're not caught off guard. You're not increasing their anxiety and you're not upping things. Keeping everything grounded, giving feedback, and maintaining that supervision. So again, I was talking to you all about, like, if you ask Liam to put up a puzzle, he can do it if you are there giving him prompts. Things have to be broken up into small chunks. And I know that that's something else that's always talked about in early childhood, is breaking those things into small chunks. But for these children, you really, really have to. So that visual guide would break those things up into those small chunks to remind him, step 1, step 2, step 3, however. The lots of repetition and modeling, of course, the more they see things, the more things are going to sink in. Think younger and keep things concrete. Rule of thumb for any individual with fetal alcohol spectrum disorder is you take their age and you divide it in half, and that's their functioning level. So you take Liam's 8, divide it in half. His functioning level is that of a 4-year-old. And when I share that with his teachers, or when I share that with other people, it makes more sense to them, and they understand better how to help Liam, how to treat Liam, and how to be supportive for him. You have to be trusting for these kids. They don't know what's coming next. They know that something's not right for them. So being that trusting person and having that relationship there with them, that you're not going to get mad at them if they can't put their socks on today. You're not going to get upset if they knock something over because their impulsivity, they had to knock it over. You're not going to be mad. They know that they were in the wrong when things like that happen, and you need to be their safe place. Avoiding overload and distraction, again, keeping things simple, keeping things manageable. We don't go, well, for the longest time, we didn't go out to do much, but we don't really go to places that are crowded anymore at all. We try to steer away from them because I know that he's going to get overloaded and what's going to happen there. Again, breaking your task into smaller steps and being very specific. These guys are 100% concrete. They are the most concrete thinkers, just like an individual who does have autism spectrum disorder. They are very concrete thinkers. They cannot see abstract. They're seeing and hearing what you say in that moment. And a big one that is very hard, but it's using the same strategies and being consistent. And I'm using Miss Tina again because she's on here. Miss Tina sat down with us for Liam's IFSP meeting when he was in her classroom. And she said, this is the first time I've ever done this. And I thought, oh gosh, because this is what should be going on. So if you all as teachers are not sitting in on things like IFSP meetings or having conversations with these parents, how do you know what they're doing? How do they know what you're doing? And so how are you all keeping it consistent so that this child is doing the best that they possibly can? And that's really for all kids. It's not just for my little neuro spicy guy. Okay, so these are two things every school year. When we go in for, what's it called? Open house. When we go into open house, I walk in and I hand the teacher this book, the Trying Differently Rather Than Harder. And I hand her this packet, the FASD Success, Understanding the Individual with Fetal Alcohol Spectrum Disorder. Sarah is going to plot that in the chat for you all to have a copy of the Fetal Alcohol Success thing. It's got all kinds of information in there for you all. But it just shares things. I honestly feel like every child should have something like this turned into a new teacher, because this talks about things that are their strengths, things that are their triggers, just various things like that. I hand it to my teacher. After the first time I did it, I think they kind of passed on of, yeah, you really need to look at this. But every teacher has thanked me for handing them this, and sharing this information with them. You know, it's not something that they wouldn't know. Trying differently rather than harder. 100% taking all of the theory, all of everything that I learned in college, everything I learned in my master's degree, everything I have ever learned, and throwing it out the window and learning how to do things just a little different. I say throwing it out the window, and maybe it's not throwing it all out the window, it's tweaking them to where they work for Liam. So these are just two huge resources that I would recommend for anyone. You can get the Trying Differently Rather Than Harder on Amazon. It's super cheap and it's a super easy read. I read it in like 30 minutes. So we do have Fetal Alcohol Awareness Day. That is September 9th. It is the 9th month and the 9th day to promote 9 months without drinking alcohol. The big promotion that they're trying to do is actually trying to educate educate women of childbearing years that they shouldn't be drinking at all if they're of childbearing years. Now I know better because I was once in college, but just saying that would be the general rule of thumb. But September 9th is National Fetal Alcohol Spectrum Disorder Day. What you all are going to see when you all get a lot of these things that I've sent to you all is that most of it comes from Canada, because the United States is so far behind when it comes to fetal alcohol spectrum disorder. Just this year, something was passed with legislation that actually gave money to each of the states to work on prevention and identification of children with fetal alcohol spectrum disorder. I want to say it was roughly $1 million per state, which when you plot that in the state, that's not much. It'll get sucked up by somebody. They'll say they did something and they'll move forward, and we're never going to hear anything about it. So most of what you're going to see is out of Canada. Florida actually has an institute for individuals with fetal alcohol spectrum disorder and a learning center. And then I want to say it's the University of Wyoming, which was odd to me, but they're also doing a lot of research on fetal alcohol spectrum disorder. At this point in time, I was told the University of Kentucky is getting ready to start doing some things with fetal alcohol spectrum disorder. You know, we talk about autism all the time, and it's because at some point somebody rattled their cage. We all started talking about it. Parents started talking about it. They wanted things for their children, and so that's why us mothers now of the fetal alcohol spectrum disorder, we're going to start rattling cages and trying to get other things for our children too. So why do I love a person with fetal alcohol spectrum disorder? What do I love about them? They're very creative. They're very creative. We're constantly creating something new. This week, we're stuck on a farm. Again, just like the he wanted the carnival with those stinking dum-dums. He is being creative. He can think up all of these things that he wants to do. Now I know I have to be careful to make sure he doesn't follow through with them, but he can think of all these things that he wants to do. Their gifts and talents are amazing. He can pick up anything he wants to on the piano and just play it. Never had a lesson a day in his life, can just play it. He loves the drums, the beats and all of that he can come up with the drums. It's amazing to me what they can do. And like I told you all, he's so lovable, so lovable. He is referred to as the hug machine. He loves being called the hug machine. Just, I think it started out with him, honestly, because he needed that hug and he needed that tight squeeze for that grounding him, for that sensory piece. But then he just learned that I just love giving hugs and I love loving people. So my sisters would always say that he always has a smile on his face. 90% of the time, he has a smile on his face. Once you flip that switch, you're in trouble. But so I'm going to go through a couple of these real quick too. Again, this is the FASD success, 100% from Canada. Again, think stage, not age. What stage are they in life? And this can apply to any child that you're working with in early intervention. What stage are they in life? Is it dysmaturity? So don't tell somebody to act their age. You need them to act their stage. In order to change the minds in the minds of others with fetal alcohol spectrum disorder, we have to change some of the terminology. So instead of calling it a behavior, call it a symptom. Can he control this? Is this a behavior because he's choosing to do this, or is this a symptom because this goes along with the complexity of his brain and the brain damage that he has from the alcohol? We were seeing a doctor locally, and then we went to another university to get the fetal alcohol spectrum diagnosis. When I came back to the local doctor, he looked at me and he said, "Why did you go get that diagnosis? What difference is it going to make? What difference is it going to make in how you treat Liam or Liam's being treated?" And my answer back to him was, because if Liam does something later on in life, I need him to get help and not just get punished. So that's here too. It's that mindset of changing, going from punishment to supports. It is a brain and body-based disability. The majority of people do not have visual features. It is known as an invisible disease or an invisible disability. The space between what they know and what they can do is actually the disability. So again, that's that executive functioning piece that we were talking about, or that I've been sharing with you guys about. They know a lot. They know a whole lot. They can repeat things to you for days and days and days. It's how you put the two things together. It's the inability to put the two things together to do what they're supposed to do. Don't get caught up thinking, I'm sorry, give me 1 second. This is my sister and she's called 3 times. My apologies. I'll text her, see if she's, okay, I'm ignoring him. Okay, what happened with Liam when he was considered to be the perfect child in kindergarten, or the ideal student? They pulled all of his supports. Every one of his supports were pulled. So from 18 months to the time that he ended kindergarten, he had supports and he was flourishing. He was flourishing. He started first grade. When he started first grade, he had no supports and it all went down the tubes. We have not caught up. We are still functioning at that first grade or below level. Our reading hasn't moved forward. And so with these children with fetal alcohol spectrum disorder, it's truly, once you get them somewhere, you cannot pull those supports. Those supports have to stay there in order to help them continue to move forward. Is it misbehavior? Is it misunderstanding? They're not giving you an attitude. Again, is it a behavior or is it a symptom? Is it part of their disability, or is it just because they want to be a pain in your rear end that day? The less you talk, the more they hear. Okay, this is a big one that I've had to talk with at the school. If you tell Liam he's in trouble, you just have to say, you knew not to do that, stop. It's those simple, clear, I don't want to say demands, but those commands that you're asking him to do, or the simple things that you're wanting him to do. The more long-winded you get, the more you try to explain things, the worse things are going to get. To be 100% honest, I've had to step away from some of my family because they don't understand this piece. This is a trigger for Liam when you're constantly talking at him. And so I've had to just kind of step away from them for a little while because it's not a healthy environment for him to be in. Don't compare yourself as a parent. Not everyone's the same. Don't compare children. I know that Liam is going to meet developmental milestones. The hardest thing in the world is sitting down with a teacher for like parent-teacher conference, because I think he's doing great. I think he's making so much progress and he's doing so much. And then I sit down with the teacher and I'm like, crap, he's still that far behind. I can't compare him to someone else. Talked about this one earlier too, sorry. You're not enabling them. You're just giving them the ability, or you're stopping one of those triggers from happening. So you're stopping that behavior from happening. You're not enabling them. I've had parents before, well, you all know the strategy. First, we're going to do this, then we're going to do this. How often do you use that? Probably 1,000 times a day. Used it with Liam maybe 2 or 3 times before he came back to me and looked at me and he said, no, first we're going to do this, then we're going to do this. Where he flip-flopped it and it was doing what he wanted to do. So when I'm doing things with Liam, I'm not enabling his behaviors. I'm just helping him with ways that I've learned how to do them. They act first and then process later. Goes back to where I was with, it is my nightmare that one day my child's going to do something that's going to get him in trouble. We'll just have to wait and see. And who knows? And then the last thing, just going to share with you all. This was something that was on Facebook the other day, and I thought, that is so true. Using a glimmer, which is the opposite of a trigger. Just those moments in your day that bring you joy, happiness, peace, gratitude, love, just those things that make you feel good. That we look for more glimmer in our days than we do triggers in our days. And see if that's, if we can start actively seeking those if we don't have better days. And here are just references of things that I use. So let me stop sharing. I know I'm early and I'm sorry. I can see Miss Tina. Hi, Miss Tina. All right, so does anybody have any questions about anything?
So Holly, there was one question that just said, what if parents aren't aware of this condition or this diagnoses? One of the things that we like with Face It to remind everybody is that we are never diagnosing a kiddo in our classroom because we are not an MD, but we always notice things. And you need to bring the families the list of those things that you notice and send that to the doctor with them and help families be aware that they've noticed, your teacher is noticing this and they've noticed this, and kind of point them in that direction. But we can always provide resources that say, that look at these websites, look at these resources to give them an idea of these different diagnoses that are out there.
And a lot of us that are fosters, I wasn't foster, I was picked to kin, it's a whole different world, but a lot of us who have adopt from outside of our families, who we know had that drug exposure, I don't have a problem having a conversation with a parent, like any of my other friends whose children have gone through the same thing, where I say, have you thought about this? Have you considered this? Because we focus on the drugs. we 100% focus on the drugs, and these are our, our drug babies, and they use cocaine, or they use fentanyl, or they use, XYZ. And we just don't focus on alcohol when it does more damage than the drugs do.
There weren't a whole lot of other questions in the chat, Holly, but somebody does think you're really amazing. Everything that you've done for your son. I'll say Holly and I did our master's together at EKU in early childhood special ed, and this was before either of us had children. Later on in life, when we became parents, both of us had kiddos that had to go through more complicated diagnoses than we anticipated. And we had this whole wealth of knowledge that we had been taught, and it still is
Throw it
complicated.
out the door.
Yeah. When you're the parent and not the teacher, the emotions are so high that the book knowledge and everything you've done in your career sometimes goes completely out the window. And so our parents that have no skill set in this area, it's really confusing for them.
Mhm.
So, I would be patient with them. I agree with Holly. There are so many families I would like to go back and apologize to because I said things like, when you wrestle with your child at home, then they're going to come to school and wrestle. So don't wrestle with your child at home, and they won't in my classroom. And then, I had two boys, and one of them has a diagnosis and things. And I'm like, how do you get them to stop wrestling? What was I thinking? There's a lot of information that that has changed my perspective now, and I'm sure Holly will say the same thing. And especially with a lot of these neurodiverse conditions. I have a child on the spectrum, and then Holly has a child on fetal alcohol spectrum. It just there's some behaviors that you weren't even really trained on how to deal with, and now um, you have to learn how to support those. So it is complicated for families. It's hard to adjust to a diagnosis, to the grief of a diagnosis. And so we want to give them as much time and support and love as we can.
So, is it Tina Cox? Because things are popping on there. The wide set eyes, let me see. So, again, the eyes are a facial feature, but they don't have to be there. And the best way to describe the eyes is they look like an individual's eyes who has Down syndrome. They're the wide set eyes, but they're the little tiny eyes. And so they almost look like an individual with Down syndrome. The eyes of someone with fetal alcohol syndrome do.
All right, I am going to continue to put the chat in order for you to get credit for today, you have to finish a 10-question survey on SurveyMonkey. The link is in the chat now. As soon as you open that survey, you can get off of the Zoom. But you have to complete the survey in order to get credit, because that's how I'm gonna know that you completed the whole hour and a half, and it gives me all the information that I need for ECE TRIS. So make sure you can open that. I know a couple of you have two people on one screen. Make sure you each complete it. But you don't have to stay on the Zoom while you complete the survey. Just make sure that you can open it. If you have staff members that want to take this training, you want to recommend it to somebody, the Child Care Council will have it within the next week, and they will offer it free for a month. And then after that, they'll have a small fee for it. So they'll partner with us after today's training to offer that online.
I did not get my contact information on there, but I am at CASA of Lexington, so you can get on their webpage. I just decided to do something totally different with children and families that I'd ever done in my career, and I'm loving it. But you can get on CASA of Lexington's webpage and find my email there.
And then just remember that in another 2 months, we'll have another early childhood special ed training on a different topic, just to make sure that childcare providers and families know how to support these kiddos instead of having high stress levels to work with them, because we know that high stress levels in caregivers and parents can lead to an increased risk of abuse. And to make sure that our kiddos with disabilities stay safe, we want to make sure that there's as much knowledge and support out there for them as possible.
Hey, Sarah, can you drop that document that I sent you to? Can you drop that in the chat for them or email it out to them?
hold on. What we will do for sure, I don't see that you sent me anything, but we will send the
A bit
PowerPoint
earlier.
out to everybody.
Okay,
After the training is done, when we send in the follow-up email. So you'll have the whole PowerPoint, and then Holly can give me any additional attachments.
I will send you the PowerPoint tomorrow. Is that okay?
That is fabulous.
All right, I'm gonna go get my wild child.
So thank you so much, Holly, tonight.
Thank you all very, very much.
Stories.
Give Liam some love for me.
Absolutely. Absolutely.
And just go ahead, fill that survey out, and then you can hop off the Zoom. Thank you so much. And thank you, Holly, again.
Thanks, Sarah.